Adaptation of the 5A method for clients who are ready to quit. Brief interventions for tobacco cessation in primary health care. Areas covered: introduction to brief interventions, outlining when to use 5A and 5R methods, components of the 5As, the OARS OARS method for motivational interviewing, stages of change. Learning outcomes. At the end of this module, the participants should be able to describe a brief intervention, when to proceed forward with a 5A's intervention, the component of a 5A's intervention, each individual component of a 5A's intervention. Defining a brief intervention. It is a short intervention of 3 to 20 minutes. It aims to identify the problem, provides information about the problem, motivates, and assists the client to solve the problem. 5As or 5Rs. A decision can be taken whether to deliver a 5As intervention or to proceed to a 5Rs by asking the following simple questions. Are you interested in quitting tobacco use? Do you think you will succeed in quitting? Any answer in a shaded box, the tobacco user is not ready to quit, and we proceed to the 5Rs method. All answers in unshaded boxes continue with 5As model. Using the 5As and 5Rs. The 5As, a brief intervention to help people who are ready to change their behavior. The 5Rs, a brief intervention to motivate people who are not yet ready to change their behavior. The 5As brief intervention model. 1. Ask. 2. Advise. 3. Assess. 4. Assist. 5. Arrange. Components of 5As. Ask. Systematically identify all tobacco users at every visit. Advise. Advise all tobacco users that they need to quit. Assess. Determine readiness to make a quit attempt. Assist the patient with a quit plan or provide information on specialist support. Arrange, schedule follow-up contacts or a referral to specialist support. Ask. Ask systematically identify all tobacco users at every visit. OARS method. OARS is a skills-based model of interactive techniques adapted using a client-centered approach using motivational interviewing principles. These skill-based techniques include verbal and nonverbal responses and behaviors. Both verbal and nonverbal techniques need to be adapted to be culturally sensitive and appropriate. The acronym OARS model stands for O. Open questions, A. Affirmations, R. Reflective listening, S. Summarizing, which are four basic skills in counseling. Why do we conduct OARS? To establish a safe environment and build a trusting and respectful relationship. To explore, clarify, and gain an understanding of the client's world. To learn about the client's past experience, feelings, thoughts, beliefs, and behavior. To gather information, client should do most of the talking. To help the client make an informed decision. Advice. Advise all tobacco users that quitting has health and non-health benefits. Simple messages like quitting tobacco has health benefits can motivate clients to stop tobacco. Assess. Determine the client's readiness to make a quit attempt. Stages of behavior change. Pre-contemplation, contemplation, preparation, action, maintenance. Relapse can occur at any point. Health risk assessment. Complete the following questionnaire to assess the health risk due to tobacco use. Are you currently smoking or using tobacco? Have you ever smoked or used tobacco? When did you stop smoking or using tobacco? How much tobacco have you been using each day? Assist the patient with a quit plan or provide information on special support. Alternatives for chewing habit: Nelly guava veralu, Maldive fish, Valmy, cinnamon. Toffees or chewing gum may not be holistic. Even spices are not research proven for long term use. Arrange. Arrange schedule follow up contacts or refer to a specialist for support. Quitting clinic, dental clinic, addiction clinic, or any other support required. Any medication. This may depend on the decision making of secondary and tertiary level healthcare providers. It is very expensive and unavailable. Effectiveness is likely to be less than 30% in real life. Most tobacco users can give up without using medication. Many do not require counseling. In summary, a medical professional should be able to carry out a brief intervention with the aim of helping a person to motivate and resolve a problem. Open questions, affirmations, reflective listening, and summarizing are the four main skills used in counseling that helps a medical professional carry out a brief intervention. 5 A's model may be used to help people who are ready to change their behavior. Thank you.